afternoon. On behalf of Jagsonpal Pharmaceuticals Limited, makers of Doxypal DRL Doxycycline 100 mg capsules, the drug approved by government for treating COVID-19 patients, in the fight against coronavirus, LycoRed softgels provide the required defense to boost the immunity. And during the COVID times, treat anxiety with Equilibrium. I am Dr. Vipin Tyagi, along with my teammates, Dr. Deepika Chhabra, Mr. Amit Saxena. We welcome and thank the office bearers of Delhi Medical Association for organizing weekly academic program every Saturday with Jagsonpal. The first in the series is this panel discussion on management of COVID-19 at home with the esteemed faculty present with us today. Welcome to all attendees. Please post your queries by text in the Q&A box to be answered at the end. Please note this webinar is streaming live on DMA Facebook. The recording will remain on Jagsonpal's YouTube channel for reference and promotion. I will now request DMA President Dr. G.S. Grewal to kindly initiate the session.
Thank you. Thank you very much. Good afternoon and namaskar to all members of Delhi Medical Association and my esteemed faculty, along with the State Secretary, Dr. Ajay Gambhir, and the State Finance Secretary, Dr. Alok Bhandari. Ladies and gentlemen, this is a small, humble beginning by Delhi Medical Association to initiate academic activities from this platform. I'm sure you'll all feel that for a number of years, we've not had an organized, systematic academic activity from the Delhi Medical Association, for which we are very soon going to form an academic council of the Delhi Medical Association, which will be a multi-speciality academic council, which will look after and oversee all academic functions and activities from the state platform. Before I start, I express my deep condolences for all the doctors who have lost their lives in this fight against COVID. And I extend my deep sympathies with the families of all those doctors who have lost their lives. We have lost knowledge, we have not lost lives. The challenge is unsurmountable, and every small contribution by every citizen in whatever best way he can do will contribute to our fight against COVID. Friends, there are so many queries. We call it the novel virus, we call it the novel treatment. And there are a number of people who are involved in giving and supporting the doctor colleagues in managing their cases on a day-to-day basis, on an hour-to-hour basis. Even I keep calling my friends and colleagues. So we thought, let's start with this statement that COVID management, not in the hospital, but outside the hospital. And then our next subsequent series shall be in hospital and post-COVID. I have with me absolutely privileged, and I'm sure you'll all agree that the faculty we have assembled today, I must thank them for joining us on this very difficult task. Humbly I introduce the faculty. Professor Jugal Kishore, the head of Department of Community Medicine at the Safdarjung Hospital and Bardhaman Medical College. Dr. S.K. Gupta, I'm sure you all read his snippets every day in the morning, and people start looking their WhatsApp, कि आज Dr. Gupta ने क्या लिखा है. Dr. Prem Aggarwal, the cardiologist cum critical care physician, helping every physician at every hour of the day in how to manage the COVID patients. I think the name Dr. Naveen Dang is synonymous to investigations and laboratories all over the country. It's a privilege to have Dr. Naveen Dang. It's a great privilege to have Dr. Harsh Mahajan, director of the Mahajan labs, as our consultant for the radiology. We have two of the most distinguished physicians of the world, a matter of great pride and pleasure to present Dr. Rajesh Chawla, the senior consultant from Indraprastha Apollo Hospital, and Dr. Vivek Nangia, the director of medicine and pulmonary care at the Max Hospital. I'm sure you hear them every day and we refer to them every hour. We have with us Dr. Vishu Bhasin, the director of Bhasin Path Labs, who would be talking about the antibodies. And we have our state secretary, Dr. Ajay Gambhir, who has been associated with Vaccine India and with the vaccine movement right for the last 15 to 20 years. So you can see that the faculty stems from all specialties which are needed to cover the COVID care. I'll first introduce, I will start the session with Professor Jugal Kishore, and the format of this session is a question answer session. And let me tell you, ladies and gentlemen, paper leak ho chuka hai, so the panelists know what they're going to be asked. So nobody's going to get great marks for their great answers. But we thought with paucity of time, we'll go in a question answer format. So Professor Jugal Kishore, sir, the present epidemiology of the disease. What are waves? Everybody's talking of first wave and second wave. After all, what are these waves? And are waves in a viral disease or a pandemic mandatory? And what do they signify? And what lessons have we learned in the last 1.5 years, especially with reference to mutation? Professor Jugal Kishore, sir,
Thank you, sir.
All the panelists to stick to a time of about 5 to 8 minutes so that we get a buffer. Yes,
Thank
Professor.
you, sir.
Thank you.
Thank you, sir. Thank you for inviting me and asking this question, which is pertaining to public health. At present, I think 170 million people have already suffered in the world and 35 lakhs has already died. And if we compare with the world, then 27.7 million in India has suffered, and we had almost 3.2 lakhs death. That is coming to be 1.1%. And it is less than what we have the national, we have the international figure. That is around more than 2%. So our death is less as compared to, people are debating on it because our reporting system of the death is always controversial, but I personally feel that the deaths cannot be hidden. Therefore, whatever death has occurred is actually measured. Sir, you have asked important question like that, whether the wave is, to be there or it is what it representing the wave. Actually, the wave is representing the number of cases occurring in the community or in a population. Every day we have number of cases. So you just plot a, graph. And on one side, the days are going on, like on the x-axis, and the y-axis is number of cases. So in a graphic representation, you have the numbers showing over a period of time. And through that, you can see how the population is doing, how the disease in population is doing. It is going up, down. So the wave actually tell you what is happening in the community. And it's very interesting that, now we are seeing the second wave in the country, but also in the international, internationally also we have the second wave, and the second wave is going down. But it's very interesting if you compare the, different states, different countries, you will find that there is a difference of wave. And that is actually studying of these waves are telling you that what kind of population we have and what, problems are there. So waves are presenting, what is happening in the population. When we look at the Delhi, sir, you will be surprised that we have already had the 4 waves, but at the national level, we have only 2 waves. So how this is differ? So actually every wave is representing that some kind of human, activity has occurred. So these are all the dynamics of the, infection, which